Welcome to the Southern Piedmont Beacon community. The goal of the Beacon project is to use health information technology to improve the health, really, of the citizens who live right here in the Southern Piedmont. But we've learned just having great computers, even having computers in the office, is not enough. This has to be a combination of high-tech and high-touch.
Care management has existed in the past, and information has existed in the past. And what we've really tried to do is bring the two together to make an effective care program that's really going to make a difference in the lives of the patients in this region.
Case management currently sits in the hospital, and we look at discharging patients and making sure they're safe. But then when they leave, they have no one that picks them up and continues their continuity of care. So we decided to put 3 case managers in the primary care office. And of course, if you understand where healthcare is going, it's now called the medical home.
We kind of just serve as a bridge and fill those gaps between the acute care in the hospital and the primary care here in the community. So we kind of interact as a liaison.
Looking at it from more of a holistic approach is what I'm trying to do. I have to get to know where they're at and what their struggles are. I've had people tell me that they're losing their house, so they had to make a choice to buy medicines or pay the house bill. So what I'll do is I'll get to know where they're coming from, and then I work with all the resources to try to help them overcome those obstacles.
CMIS stands for Case Management Information System, and that is a place where us case managers can go and document what we're doing with these patients. There is a link or ability to look at what we call the provider portal, and that will pull the most recent Medicaid claims for that patient. So you can see when they've gone to their medical doctors, medications that they've been filled that Medicaid is paid for, if they've gone to therapy, any DME, medical equipment, things like that. So it kind of gives you a little bit of an overview about what's going on with them and what other services that Medicaid is using and paying for those patients.
So I get alerts from that system that tells me each time somebody hits the hospital doors, which is really nice. That belongs to this practice, only to this practice. So, it would be very cumbersome if you had more than one practice, but I'll see it across my email that I've got an alert, and then I know I need to go into the care management information systems and pull it up, and there will be the person's name there, and it tells you the date that they went into the hospital.
It's amazing what technology has provided for us. We have a tracking board on the computer that tells us when a person's in the emergency room, what they're getting while they're there. And if that little running man icon shows up, then that means that person is what we term a frequent flyer. He's a frequent user of the emergency department and the hospital. And so we want to identify those people.
And the average emergency room cost is about $2,500 worth of care, when in fact you may not have needed that much. If you go to your primary care physician or your medical home, you're talking about $65 to $100 maybe.
And then we're also able to get into the system and schedule appointments for patients, actually live time right then and there. So we sit with the patient and our laptop and say to the patient, here are the dates this physician has available. What day works good for you?
The impact the Southern Piedmont Community Care Program has had on our practice has been significant. Primarily through helping us have care managers in the office to help us take care of these incredibly complex patients.
We've taken a population focus for our interventions. We're not just looking for patients who come into the hospital or come into a clinic, but we know who the patients are across the region, and we are able to monitor the care they receive. The other piece that's innovative with the North Carolina Beacon Project is that we do have this whole team of care managers, caseworkers, health educators, dietitians, pharmacists who can engage in the care process. So when we find problems using the health information technology, we have someone to tell.
This is about creating sustainable change. And by that we mean change in this population, change in their health, but frankly, in a big scale, change in healthcare reform, in how we deliver health care. Those are the things that inspire us.